Alright guys, we are coming to the part 4, the last part of the hypersensitivity topic, and we will wrap up this week's material with this video. Alright, I'm not going to be too chatty, and let's go start the lecture.
Alright guys, let's start the last part. Okay, part 4 of this hypersensitivity topic. So it is a really somewhat long topic in my opinion. So all the previous part 2 and part 3 we were talking about type 1. Okay, everything there was type 1. Now we just start talking about type 2. Now why we spend so much time on type 1 is that that's probably the most common one. And not that type 2, 3, 4 are not like uncommon, but it's just the context of it are not as significant as type 1. Alright, so type 2 hypersensitivity, really that's a lot of the uh, drug, okay, sensitivities are considered as the type 2 hypersensitivity. Things like penicillin, quinidine, methyl doper, those can all be, those can all elicit type 2 hypersensitivity. Alright, so just a little bit quick recap. Okay, penicillin, how it worked? It worked by forming a bond with the serine residue on the transpeptidase. Okay, now the same penicillin can also form some type of covalent bond on red blood cell. Now, if that happens, okay, like here, if that happens, really, you change the surface of your own cells, right? Okay, your epitope is changed. In that case, it will be recognized. Okay, eventually lead to formations of IgM and IgG that are specific for the conjugated drug, okay, plus some of the self-service component, and leading to detrimental effects such as hemolytic anemia. If it is on the platelet, it would be thrombocytopenia. So basically, your platelet and anemia will be destroyed by your immune system because of this foreign epitope there. Alright, so here are some of the mechanisms of what we just talked about, okay? So, Reposol covalently bond to penicillins, okay? That would code by C3b. Now, C3b, usually why are we taking penicillin, right? Because of a bacterial infection. So there are some type of complement activations already. Now here at this point, the RBC is coated with penicillin, okay, and it will further being precipitated by the C3b and leading to this whole basically in a way that's opsonized in a way. So it will lead to phagocytosis, okay, by macrophages, and all the process that we've learned in the previous lectures, okay. It leads to processings and displaying modified protein, okay, to your helper cells, okay, to your CD4 T helper cells, and eventually leading to Th2 helper cells and formation, stimulating B cells, formations of plasma cells, and all these leading to productions of IgG, okay, that are specific against penicillin modified epitope. So the process are very much the same, okay. We are still talking about same immune system, but here the context, instead of a viral protein, instead of a bacterial protein, here it's just some of our own protein being mistakenly recognized and being promoted to for it, being promoted for an immune response. Like, so here are the the consequences of the IgG productions. Okay, so really is the continuous story. So the IgG being produced, okay, what happened, it will lead to classical pathway of the complement systems, okay, and basically activations of complement C1 to C9, and then forming the membrane attack complex, okay, so it will lead to cell lysis, okay, instead of lysing the bacteria, now you're lysing the red blood cell, so therefore we have that hemolytic anemia. All right, and basically you activate also the complement 1 to 3, okay, that pathway lead to further opsonizations, okay, by the antibody, and basically lead to engulf by the macrophage, so you lead to even more engulfing, and therefore causing a cascade of reactions and leading to the major symptoms, anemia. Alright, so another type of type 2 hypersensitivity is something that you've learned already. Basically, is the ABO blood type mismatch. Okay, so I won't go into too much detail of it. So that is something that we talked about in AMP last year by me. I don't know if that's fortunate or unfortunate again, right? So here, basically, it's the same concept. That's why I won't go into too much. If you have a mismatch, okay, if you have a mismatch of the ABO blood type, these are some of the listed symptoms, okay, that can displayed on the patient: anemia, fever, chill, shock, renal failure, and the worst case is death. Okay, so there are this dominant and recessive system, so I won't go through it again. I think by this time there's a pretty straightforward concept. Alright, so here again showing you the same information. AB being dominant, O being recessive, O being universal donor, and AB universal receiver. So these are the same concept. You can read about it. Those are not that difficult in my opinion. So basically just AB, you can take A and B and O, right? And then O, you can give it to A and B and AB, and B can take O, A and can take A and can take O. So these concepts are quite straightforward in my opinion. So another factor, Rh factor. Again, we've talked about those in the past. Okay, Rh factor. Majority of the people are Rh positive. Okay, and then the very little, about 15% of the population's lack of the Rh factor, so-called Rh negative. Okay, and the implications of this Rh factor is that the Rh is being a dominant feature here, and the problem comes when you have a lady. Okay, when you have a female that have negative, Rh negative, and carrying a Rh positive child, marrying a positive man, marrying a Rh positive man, and then carry a Rh positive child. Now the first one are not that bad usually because there are no crossing between the blood between the mom and the kid, and so the mom are not recognizing the Rh factor in the blood. Now during delivery, and then there's some cross blood contamination, then mom will later on start developing antibodies to go against Rh plus factors, and the problem comes with the second child. Okay, it comes with the second child. In those cases, the antibody can cross the placenta and cause harm with the second child that is Rh positive. Alright, so those are some of the older concepts that we've talked about. That's why I'm kind of just flying through it. Alright, we move to a type 3 hypersensitivity. Type 3 hypersensitivity really is the key word here is the immune complex formations with the antigens and antibodies. So we're talking about a big glob of things. So these antigen antibody formations are normal, okay, part of a very normal process during the course of a immune response. Okay, usually these things will be cleared by combinations of complement fixation, basically complement interactions, okay, and phagocytosis. They will be cleared up Okay, but the problem arises if the complex are not cleared up. They may deposit onto the blood vessels endothelial wall, basically, i.e., the the inner layers. Okay, so this is the blood vessel, the inner layers of the blood vessel. It will deposit there. All right, accumulated, and these accumulations will attract. Okay, affix here means interact, attract complement systems and initiate tissue damaging and inflammatory responses, so that it become bad. Now, when or how does these antigen antibody complexes cause problem? It really depends on their size in many cases. Okay, the smaller they are, the more difficult to be cleared. Okay, not cleared well, and then they get a chance to deposit into the vasculature endothelium wall. The medium to large size, those will be easily clear, so they are not as problematic, but not having as high potential to be problematic. Okay, and also, if your affinity or if your binding of antibody to antigen are not very well, okay, are not very well, so the complex are not uh, able to interact with your complement, then there are chances that they are not being cleared initially and start interacting with the vasculature wall and leading to the same problem. And again, some special type of antibody, some different isotypes of antibody, particularly those IgG4, G2, IgA, and IgE. Now, these the antibodies cannot really interact with the complement system, and they are more prone to forming complex that cannot be cleared. So those are some of those examples that can lead to type 3 hypersensitivity. Alright, so here is the graphical representation of what I talked. Okay, so this is a picture on the left. Here shows you the small complex, okay, interacting with small compound. They are not cleared from the circulations. And here is the large immune complex and medium-sized complex. They can interact with the complement and be able to clear from the circulations more easily. Okay, and here what some of the example of type 3 is through a local injection of some type of protein. Okay, so here is one of the term here. First term is the author's reactions. Okay, this reaction is first described by a I believe it's a physician, someone named with a last name authors. Anyway, okay, this injection reactions lead to a hard swelling. Okay, hard swelling. Okay, here is the graphical representations of what's going on. So there is some local injection of antigens. Okay, and it will with the IgG antibody and start forming immune complexes. Okay, and that lead to activations of the complement systems, and in here this picture shows you lead to bind to the C5a receptor on mast cells. Okay, so the C5a being truncated off, okay, through the complement system will bind to mast cells and lead to degranulations of the mast cells, and further down lead to release of inflammatory cytokines and chemokines and attracting different type of macrophages to sites, leading to basically abnormal immune response. So this is the rundown of the steps. Alright, so another example here are the horse serum. So basically, we talked about a little bit last time when we talked about antibody therapy. So historically used to treat certain infectious bacteria, infectious diseases diphtheria, scarlet fever, tetanus, and those are helpful in many cases, but could also trigger a type 3 reactions. Okay, now here are some of the symptoms and durations. You don't have to really memorize too much. These are pretty generic. Chills, fever, rash, everything have a rash. Okay, almost like, and then the particular antibody here is the IgG being produced against these foreign horse protein complex formations. Okay, and here this table give you a nice summary grouping different types of places in terms of the resulting disease name. In joint is arthritis. Okay, so those are nice summary tables in my opinion. Alright, so looking at a time course of a serum sickness, okay, here you inject a serum from the horse and it contained antibodies and some antigens, and so it will have an initial spike. Okay, this shows you there is a huge increase in the bloodborne antigens. Okay, and over time it will decrease because your immune systems will take some time to your immune system will take some time to react, and during this phase the bloodborne antigen will be slowing down in terms. What happened is still there are foreign substance. Okay, your body start clearing some of these foreign protein, and at the same time here showing you the formations of this antibody antigen complexes that are the type 3 sensitivity. Alright, so these things are pretty much self-limiting as soon as these complexes are being cleared up completely, so this type of serum sickness will resolve in time, and in the meantime your own immune system will generate antibody against the bloodborne pathogens and take over the whole thing. Now, but during this stage, some of the rash could be bad. So there are some. These are some of the pictures showing you, rashes. Okay, there's pretty. We're talking about a lot, significant amount of area that having rash in response to these type of hypersensitivities. Okay, I won't go into very detailed of these cases. Alright, to the last one. Okay, finally we come to the type 4 last one. Type 4 delayed hypersensitivity. This is a funny cartoon. Okay, you guys can take a look of it. So what happened is that this Adam and Evie mistakenly put the poison ivy on himself. Okay, so I think it's kind of funny, this picture. Alright, so here is the golden word: reactions mediated by antigen specific effector T cells. So this is the same message I began with this topic. Okay, and I pretty much will wrap up with the same message: effector T cell. Okay, in this case, no antibody. Okay. Alright, so if you are casually watching this lecture on a couch or somewhere, this is the main message I want you to get out of it. Okay, you can always definitely come back to watch these video again and again and again. But anyway. Okay, so here is the table that are summarizing some of the common antigen that can lead to type 4. Now note that some of those can also lead to type 1. Okay, some of the insect venom, i.e. bee stings and wasp stings, can also lead to those. So sometimes they're double dip. Okay, another common one, mycobacteria proteins. Okay, tuberculin, lepromin. So what are these? Okay, basically they are TB test. Right, when you need to go on for rotations, right, you potentially need to do those TB tests showing you have no not even a latent infections of TB inside your body. Alright, so the consequences, the reactions, a little bit swelling, redness. Okay, and maybe some a little bit itchiness, Contact type of so-called dermatitis can also be classified as type 4 hypersensitivity. Okay, in particular, poison ivy. Okay, poison ivy is one of those main things. Nickel. Okay, we talked about nickel being type 1. The most, it can also lead to type 4 hypersensitivity, but usually those are a little bit takes a little bit longer. Okay, it takes not as as quick as type 1. Okay, and the other common one is gluten. Okay, gluten sensitivity. All right, so we'll talk about each of those in the later slides. Okay. Alright, type 4 sensitivity here. Notice the time frame. We're talking about 24 to 72 hours. So it takes days. It takes a couple days for it to have the things happen. So first of all, there is the antigen being introduced to subcutaneous tissues, and then go through the same antigen processing and very same old story. And in this case, it's going to present it to a Th1 effector cell. Th1 effector cell recognize the antigen and start releasing cytokines. Okay, all these cytokines will add on the vasculature endothelium, and then lead to leading to more recruitment of sorry about that, macrophages, and further down lead to swellens and basically a injections site reactions. Okay, alright, this is a little bit recap, I feel like. So once the antigens presented by the tissue macrophages, it will stimulate Th1 cell, and after the stimulations, you will have all the cytokines, interferon gamma, TNF alpha, and IL-3s, and GMC FCSF. So those things we've talked about it in an earlier case. So it really down to the point again. Don't think of it hypersensitivity as something that is completely brand new. Alright, it is still the same type of a response that we learned. Okay, if we learned weeks ago. Okay, the only difference here is now it is not a bacteria. Now it is not a virus. Okay, so that's the only difference is there. The mediator coming out of it are the same essentially. Alright, so the most common example people use to describe or to explain type 4 hypersensitivity is from poison ivy or poison oak. Alright, so there's one compound in that plant, okay, particularly this pentadecacatical. Okay, there's a lot of A here. So this is compound, don't need to memorize these things at all. Okay, here just to show you what this little compound look like. So this compound, once you touch this compound, it will go through your skin, okay, and then recognized by the skin macrophages, or we have a special name, Langerhans cells, okay, and then go through the MHC class 2 processing, and then lead to CD4 Th1 cells, and then lead to all the stimulations, activations of macrophage, release of cytokines, and then later on forming memory T cells. Okay, now it can also penetrate cell membranes and forming adduct with intracellular protein here. So here we have the cells, and this little compound goes through. Okay, now here it's outside. Okay, here is not inside the cell. I think of it as bacteria, but not the best way to think of it, but you could think of it like that. Here is that we have a small molecule went through the cell membrane. Okay, just like a virus go through, went to inside the cell, start interacting with the cellular protein. Now at that time those protein look foreign again, and then being processed and presented, okay, by MHC class 1, and then interacting with CD8 T cells, and then forming cytotoxic T cells, and basically kill the cells. Okay, now again, these concepts are going, you can see these concepts and interaction going around and around and around again. So you really cannot forget what you learned earlier on, even though I really didn't emphasize that much. Right, so that is type 4. So contact dermatitis. Okay, this is you can see that it is not just a mild rash type of reactions. Okay, it is quite significant and looks very painful, right? These blister formations are just nothing, that's just not something that is pleasant at all. Okay, and same here, that when I didn't talk about it, but the nickels, okay, nickel metals can, in severe cases, can also lead to things like that nature. Alright, and then we have the celiac disease. Okay, celiac disease is a inflammatory autoimmune disease which you will likely learn about it in the GI module, I hope. Okay, GI. So here is a immune response to gluten proteins of wheat flours, okay, and particularly those related to barley, rice, bread, okay, basically bread. Alright, so what happened is that in this case, the CD4 T cell respond to gluten-derived peptide in gut-associated lymphoid tissues, GALT, gut-associated lymphoid tissues, and activate macrophages and secrete inflammatory cytokines. Same old story. Okay, so if you persistently challenge the gut with these things, it will cause chronic inflammations, leading to the deformity of these celiac jejunum in this picture. It makes it difficult to absorb nutrients when it's needed to, and also you have something that is not normally looking in your gut. The one of the major symptoms is diarrhea. Alright, so in case you wonder what gluten is, here is the gluten, this stretchy stuff, okay, when you're trying to make a dough or trying to make a bread. Anyone make bread at home at all? So really what happened when you make a bread at home, you knead it, you mix it with water, and or make piece of dough, the same thing. You let it rest, okay? The glutens are, the more you play with the dough, the more stretchy it become, and once you rest it, it become less stretchy, and you can work on it further on. Alright, so just some side note on gluten. Now, once you eat the gluten inside your body, it will be degraded, okay, and the degradations basically will lead to a giving the peptides some type of a negative charge. Okay, these negative charge can interact or bind to positively charged binding pocket on a special type of HLA-DQ2. Alright, so it binds to DQ2, and what happened is that it will go through the same antigen presenting process. Okay, now it go through the same antigen presenting process. Now this is a class 2 processing. Alright, and then it will eventually generate IgG and IgA, auto antibody that will be produced. So statistically, there are quite a third of the populations of the Caucasian populations have this type of a gluten, those HLA protein that can interact with metabolize the gluten molecule. Okay, but only very few, okay, of that particular groups of people can lead to the celiac diseases. Okay, so it's not a definite answer, but the gene does play a role. Alright, so that's really pretty much the everything that is on hypersensitivities. Now the following couple slides of tables are really excellent summaries for types and reactions mechanisms, and they're very concise, so you can read about it on your own time, and I don't prefer to just read it over for you there. It's okay. And the last table outlines some various clinical symptoms associated with hypersensitivity types. Okay, so overall, I think these are pretty good reference table. All right. So and here the last one, last table, it's on the diagnostic and hypersensitive. What lab test could be done. Just get a general idea is fine. Don't need to be very commit to memory or anything like that for that tables. Okay. All right. So it's gonna be question time after this, right? All right, guys. We are coming to the last round of Who Wants to Be a Millionaire for this week topic. Now, it's not going to go up to $1 million questions, okay? So there will be two more questions for this topic, and let's begin the game. All right. So it's the $4,000 question. Reaction to poison ivy is mediated by A. IgG, B. IgE, C. Th1 cells, and D. Th2 cells. This could be a little bit tricky. Now, again, if you are paying attention for the past 20-30 minutes there, you should be okay with these questions. Well, think about what type of hypersensitivity it is. Oh, I shouldn't give you hint, should I? But anyway, 5 seconds. 1, 2, 3, 4, 5. And the answer, do you have a final answer? I do. Alright. It is C, Th1 cell. Okay. So that is really just in the handout. So if you didn't catch that material, go back and take a look. All right. Okay, so now move on to the $8,000 questions. $8,000. Well, is it becoming higher stake? Which is not involved in type 4 hypersensitivity. TNF alpha, interferon gamma, IL-3, and IgE. This could be a little bit tricky or not. Okay, this is not as explicit as the other questions, but again, what is type 4? What is mediated in type 4? Alright, I give you 5 seconds. 1, 2, 3, 4, 5. 5 seconds. Do you have a final answer? Yeah? Shaking your head. Alright, it is. Final answer is D, IgE. Alright, guys. It is the final answer. Why is that? Right? IgE is antibody, and going way back to the $100 questions, I think, or 200. I don't remember which one. When we talk about different types of hypersensitivity, right? Type 1 to 3 all have antibody mediated, and type 4 it's not antibody mediated, and particularly not IgE. Okay, so that is really the single core concept. You have to get it out from this lecture. All right. I hope you have fun with the game.
All right, this is the end of part 4 hypersensitivity. So we wrap up a whole week of material with 4-part videos. Okay, this is new to me. This is new to you. Let me know if you like this or if you hate this. The way to like it is very easy and anonymous. Well, you can click thumbs up or thumbs down on my videos. Okay, so that way I can at least get a general idea of if I'm doing the good job or not. Now, so I cannot get a lot of engagement from you guys doing this way. And what we are going to do in the following 2 weeks is that watch out for announcements on D2L. I'll give out instructions on when I will set up virtual office hours where we can do a little bit instant interactions. Now, I haven't find out the exact format that we're going to do yet. Okay, I'll again watch out for those announcements. Okay, now also I would give out assignments. Okay, assignments. Maybe some type of a D2L quiz. I I don't know at this point yet. Now, whatever you're going to do in the upcoming weeks, those assignments will be graded and then tied back to the third assignment grade that is according in the syllabus. Those will be counted. So you are accountable in this way. You're accountable for going through the material. It would, if it is a B2L quiz, it would be pretty easy one. You can flip through your notes. The idea is that at least you are flipping through your notes. Okay. All right. So that is for this week, and I'll see you guys in the next week's topic. Okay. Bye.